there, my name's Abby Knight, I'm 57 years old and I run an events company in Essex. I decided to have Femilift because as a woman over 40 who's had a couple of kids, it became more and more obvious that there was kind of a little bit of a problem sort of down below. I think rushing around and everything, and I found more and more often that I was having sort of this stress incontinence problem that was becoming sort of less and less funny, and I thought this might be something that would help. I remember that I saw the wonderful GC talking about her designer vagina and thought, not quite sure if this is for me, but when I read sort of the other kind of sort of benefits of having that treatment, I thought, oh yeah, this could be good. Designer vagina thing obviously is an amazing side effect, but really it was the stress incontinence that made me do it. So I kind of looked into it and found out the courthouse clinics were somewhere that would kind of help me with that. I did decide to tell my family and friends, actually, not like the whole bunch, but I did obviously tell my husband, who thought was all a bit sceptic that it would work, but thought, yeah, okay, she does sort of know her stuff about this kind of thing, she would have researched it. And I told my mummy and a couple of close friends who were sort of thinking about having it done themselves, and I was like the test case for it. So yeah, I did tell a few people, and they were all quite encouraging, which was great. There wasn't anything really worried about the surgery because I did quite a lot of research and I did understand how the laser would work and how it sort of works on collagen. I suppose everyone worries that there might be some kind of pain involved, so I was really, really pleased when I had my consultation on the first appointment that I was kind of reassured that although it wouldn't be pain-free and might be a bit sort of discomfort involved, there wouldn't really be any downtime, which I think as a busy woman and as we all are running around, you don't like to think you're going to be holed up in bed for the next 3 days, so I was quite reassured that the treatment would be kind of just on the day and no real downtime. I went along for the treatment on the 29th of June, which was quite funny because bearing in mind the position you have to get into was the day that I would have had my son 21 years ago, so it was quite funny that I would be in this compromised position, but that was just funny. But the lady who gave me the treatment, Dr. Kesha, was really, really great. She gave me a thorough consultation. She did say it's going to be slightly uncomfortable, but she did say that it's so quick that by the time that the warmth of the treatment builds up, it's kind of over. They use a kind of a laser frequency, and that's how it kind of works, and it kind of worries the skin tissue, as it were, which then sets up a sort of reparation process that makes it get better and makes it get tighter. So it was slightly uncomfortable, but nothing really to worry about, and in 5 minutes it was all done. I don't know whether I had any preconceptions of how it would feel, and I didn't think it was going to be one of those things like having a spray tan, you've got an instant result. It was told to me that it would probably be 3 months that I'd see any real result, not see, but feel any real result. And Dr. Kesha said probably I'd need to have 3 treatments altogether, and it was best to space them out because the first treatment would build up slowly, and then by the end of the 3rd treatment you'd really notice the difference. And it was quite true actually. By the 3rd treatment, which sort of took place over 6 months altogether, I thought, yeah, this has really worked. After the treatment, I was sort of pleased that I'd sort of gone through with it, and I wasn't expecting sort of miracles, and I didn't have any real downtime. I mean, you do have like a tiny bit of spotting actually immediately after the treatment, and you're given like a sanitary pad, which was fine, but really there was no downtime at all. I wasn't expecting any, and there really wasn't, so that was great. And subsequently, you can sometimes need to have a maintenance treatment, but this is probably 2 years now. Yeah, 2 years, and I haven't had to have anything. It's really worked, and I think the benefits have actually got better if that's possible. Having this treatment, I think, has been a real confidence boost. As I say, I'm quite a fairly confident person, but it's not great having to, wet your knickers frequently when you have sneezing or laughing or whatever. So I suppose I've not got more adventurous, but it's been great for my real big hobby, which is salsa dancing, because that does involve kind of swinging around and going crazy on the dance floor. So from that point of view, it's been a real confidence booster. So okay, I'm not jumping out of planes, but for my everyday life has really improved, and I thoroughly recommend it to anybody. I think my husband was a bit sceptical about having the surgery. He wasn't down on me having it, but he wasn't quite sure if it would work. But as he knew that I'd do my research, he was quite happy that I'd go ahead with it, and he's very pleased with the result, shall we say. He's pleased that I'm more confident, and has got that little benefit effect that everyone, it's funny, the designer vagina thing, obviously there is something in that. And all my friends and family are pleased that I did tell, are really pleased that it's been positive, and as I have gone to recommend it to a few people. It's just amazing, because obviously anyone that's had a couple of kids or any kind of invasive surgery before, it can be something that's a problem, and this really does help. I'd recommend it to anyone really that is sort of maybe considering surgery for this kind of thing, because to have surgery for stress incontinence is quite a serious thing, and I've heard quite a few sad stories where it hasn't worked and people have been left in pain, and obviously it's much more invasive. So something that is such a sort of simple and quick and virtually pain-free treatment, I would really recommend it to anyone that's suffered with stress incontinence to the point that it's become embarrassing or it's impinging on their life and it means they can't do their favourite things. So I don't think there's really even any age to it really, because obviously when you have babies it can be any age kind of thing, but I think as you get older and your kind of pelvic floor isn't as strong, then it's probably something that's post 35 is something that's going to be more relevant. I had sort of been to the courthouse for wonderful facials and the occasional Botox treatment, so I did know that when I sort of went along for the Femilift treatment, I was going somewhere that would really be kind of not only sort of leaders in what they were going to be doing with this treatment, but have the sort of backup. So should anything go wrong, which was highly unlikely, or had any sort of pain or inconvenience afterwards, that it's very much doctor-led. You have a very thorough consultation, you're very much reassured, and the fantastic thing, I think, within 24 hours, if anything gone wrong, you've got a doctor on call there that you can give them a quick call and just say, is this normal, should I be feeling this? As it turned out, my treatment was excellent. It's very rare this happens, but it's great to know that the team at Courthouse are really clued up and there to help you if there's any problems at all.